As a past president of the American College of Cardiology, I am especially honored this evening to introduce my friend and colleague, Dr. James S. Forrester, as a 2016 medical honoree of the Sheila Health Foundation. Dr. Forrester is an iconic figure in the history of American cardiology and has made important clinical and research contributions recognized around the world. Indeed, Dr. Forrester has been involved in transformational research that has influenced the delivery of cardiovascular care on a global scale. I had the privilege of nominating Dr. Forrester to the American College of Cardiology's Lifetime Achievement Award, which he received in 2009. This award is given to an individual with a lifetime of outstanding achievements in the field of cardiovascular disease and who has served as a role model through service, basic or clinical research, and teaching. Dr. Forrester was the second recipient of this prestigious honor, which is recognized as the pinnacle of professional achievement by the American College of Cardiology, which represents 52,000 cardiovascular professionals across the world. Dr. Forrester completed his cardiology training at Harvard's Brigham and Women's Hospital. In the late 1960s, he was appointed Director of Cardiovascular Research at Cedars-Sinai and later became Chair of the Division of Cardiology. His research over 3 decades of accomplishments led to several advances that altered the practice of cardiovascular medicine. In the 1970s, he played an instrumental role in the evolution of cardiac pressure monitoring at the bedside, using the Swan-Ganz balloon-tip catheter that was maneuvered through the heart. These measurements helped to create a method of care for patients with heart attacks that became known as the Forrester classification. Measurement of intracardiac pressures allowed physicians to repeatedly analyze the effect of drugs on the function of the heart at the bedside and revolutionized the care of critically ill patients. The second advance came early in the 1980s when Dr. Forrester and the late Dr. George Diamond adapted the field of probability analysis for coronary heart disease, which became known as the Diamond-Forrester method for interpreting diagnostic studies. Their approach integrated a patient's pre-test likelihood of having heart disease with the sensitivity and specificity of the diagnostic studies to calculate a patient's post-test likelihood of coronary artery disease. The third major event Dr. Forrester contributed was the development of coronary angioscopy in collaboration with my co-presenter, Dr. Frank Litvak. Over the course of his long and illustrious career, Dr. Forrester served as a mentor for several hundred cardiologists, a number of whom are currently leaders in cardiovascular medicine across the world. In 2013, Dr. Forrester received the Pioneer of Medicine Award from Cedars-Sinai medical staff, which is the highest award that our medical staff can bestow. During my presidential year at the American College of Cardiology, I had the privilege of choosing Dr. Forrester to deliver the plenary lecture celebrating the college's 65th anniversary. We participated as co-authors for the commemorative book that celebrated that historical occasion, the American College of Cardiology, that passed its prologue, 65 Years of Cardiovascular Innovation. Dr. Forrester is also the author of The Heart Healers, The Misfits, Mavericks, and Rebels, who created the medical breakthroughs of our lives, which was published to great acclaim in 2015 by St. Martin's Press. I know many of you have received autographed copies this evening. It is a rare person who is so gifted and has used his gifts so effectively as a clinician, scientist, and educator for the benefit of mankind. Dr. James Forrester is such an individual. I'm now honored to introduce my friend and colleague, Dr. Frank Litvak, who will complete this introduction of Dr. Forrester to this award. Thank you very much.